Hi everyone, thank you for visiting this video. My name is Holly Yeh. I am approaching my third year as a psychology student at California State University, Fullerton, and the research I'm about to present assesses the impact of pain medication on activities of daily living in older adults with fibromyalgia. This research is conducted at the Fibromyalgia and Chronic Pain Center at California State University, Fullerton. The aim of this study is to assess whether the use of pain medications affect perceived physical function in older adults with fibromyalgia. So, what type of pain medications are we referring to, and how is perceived physical function measured? Well, our hypothesis is that the use of these pain medications, non-steroidal anti-inflammatory drugs, corticosteroids, and opioids will be associated with increased ratings of activities of daily living and instrumental activities of daily living. So these ratings are what we use to measure perceived physical function. Okay, so let's start by explaining what fibromyalgia is. Fibromyalgia is a complex chronic pain disorder with pain as the primary symptom. It occurs over the body and there's tenderness to touch. And fibromyalgia doesn't just affect people physically, but also mentally and socially. For example, other symptoms include fatigue, sleep disturbance, cognitive dysfunction, morning stiffness, depression or anxiety, headache, irritable bowel syndrome, and gastrointestinal reflux disease. So, understanding these several other symptoms, besides pain stemming from fibromyalgia, can allow us to understand that this pain disorder may significantly change someone's life. So, now here are some statistics about fibromyalgia. Fibromyalgia affects 2.7% of the world population and 1.2% of people nationwide. Females are 1.64 times more likely than males to have fibromyalgia. So this pain disorder is not that common in the world, but among those that do have it, there are more females with FM. So, fibromyalgia pain can affect an individual's ability to perform basic self care tasks called activities of daily living. So, these activities include walking, transferring, such as from a bed to a wheelchair, eating, dressing, grooming, toileting, and bathing. Fibromyalgia pain can also affect self-care tasks that require more complex thinking and organizational skills. So these are called instrumental activities of daily living. And these activities include managing finance, organizing transportation, shopping and meal preparation, housekeeping, communicating such as by telephone or by mail, and managing medications, which is what I'll be focusing on in the next slide. So, since fibromyalgia pain may affect some tasks of everyday living, some individuals with fibromyalgia use drugs to alleviate their symptoms. Among these are non-steroidal anti-inflammatory drugs, or NSAIDs, corticosteroids, and opioids. So the first medication I will discuss are NSAIDs. NSAIDs reduce pain and inflammation by blocking the cyclooxygenase enzyme. This enzyme produces prostaglandins, which play a role in pain and inflammation. Some examples of NSAIDs include aspirin, ibuprofen, and naproxen. According to Wolf, Zhao, and Lane, 2000, 60% of individuals prefer NSAIDs when effectiveness and side effects are considered. Essentially, the side effects of NSAIDs aren't generally too bad, but the drawback is that they might not be as effective as other medications. So let's talk about the next medication, corticosteroids. Now, corticosteroids are synthetic drugs that closely resemble cortisol. It decreases inflammation and reduces activity of the immune system. Prescription medications include prednisone and cortisone. The findings for Tyndall and Bennett 1985 indicate that there is no improvement in pain while taking prednisone for fibromyalgia. So focusing on this one corticosteroid, prednisone, is seen to not help with pain in FM patients reported by this literature. The last medication to discuss are opioids. How do opioids inhibit the transmission of pain? Well, opioid molecules attach to and activate opioid receptor proteins, which close the calcium channel and stop the action potential. These receptor proteins are found on nerve cells in the brain, spinal cord, and gastrointestinal tract, and other organs in the body. Some prescription opioid medications include tramadol, Vicodin, and Norco. According to Pang et al., 2015, opioid users have more interference than non-opioid users with daily activities because of pain. So Pang's article may suggest that omitting the use of opioids is perhaps more favorable than using it for fibromyalgia pain. Now, this is how we collected data to conduct research. The Fibromyalgia and Chronic Pain Center conducted a longitudinal study on older adults with a confirmed diagnosis of fibromyalgia. The data used for our study is from 2018. Of the 45 participants, 43 were female and only 2 were male. As I mentioned earlier, females are more likely than males to have fibromyalgia. The participants were between 54 and 84 years of age and had a mean age of about 67. They also completed demographics on marital status, level of education, income, race, and ethnicity. For our study, we used 2 measures. The first was the Physical Activity Inventory, which was used to measure perceived physical function of ADL and IADL. So those are the activities of daily living and instrumental activities of daily living. The second measure was the Health Activity Information Item 16, which is a question that states, in the past 4 weeks, to what extent did health problems limit your everyday physical activities, such as walking and household chores? This question was used to measure the extent of pain that limited the individuals from performing ADL and IADL tasks. So now onto the data analysis. A hierarchical multiple regression test was performed to predict perceived physical function based on the type of medication used while controlling for the variables of age and pain. Table 1 shows the hierarchical regression results. In step 1, age was used to predict perceived physical function. In step 2, age was controlled and pain was used to predict perceived physical function. In step 3, both age and pain were controlled and the type of medication was used to predict perceived physical function. So these are our results. The effect of age was not significant. The effect of pain was significant. For the effect of NSAIDs, corticosteroids, and opioids were not significant. So of the 5 predictors, age, pain, NSAIDs, corticosteroids, and opioids, the effect of pain was the only statistically significant predictor of perceived physical functions. So essentially, through our data analysis, pain was the only significant predictor of the participants' perceived successes on completing ADL and IADL tasks. So now on to our discussion. So to review, our hypothesis was that NSAIDs, corticosteroids, and opioids will be associated with increased ratings of ADL and IADL. And after our data analysis, we do not support this hypothesis because the effect of the use of the 3 pain medications on perceived physical functioning were not significant. Therefore, there is no association between the use of the 3 pain medications and an increase of ratings of ADL and IADL. In light of the literatures mentioned previously, the results of this present study do not support the findings of Wolf, Zhao, and Lane 2000, which showed NSAIDs as an effective medication for the treatment of fibromyalgia pain. For Tyndall and Bennett, 1985, this present study does support the literature, which states that there is no improvement in pain while taking the corticosteroid prednisone for fibromyalgia. Lastly, the results of the present study support the findings of Peng et al. 2015, which state that opioid users had more interference due to pain than non-opioid users when performing daily activities. In conclusion, there is no association between NSAIDs, corticosteroids, or opioids with increased ratings of ADL and IADL, even when controlling for age and pain, and it is suggested that these medications do not increase perceived physical functioning in older adults with fibromyalgia. Perhaps for future studies, medications such as antidepressants can be considered for patients diagnosed with fibromyalgia. Here is the list of literatures that I have referred to in this research. And thank you so much for watching this video until the end. And again, I am Holly Yeh from the Fibromyalgia and Chronic Pain Center at California State University, Fullerton.